Hi, I'm Zach.
And I'm Jules, and we're back with Life After Prison, Getting Out, where we explore different issues that you may face when leaving prison and how to adapt to life on the outside. And today is all about health.
Yes, today is all about health. And for me, I personally think it's a big factor, especially when you're beginning your life after prison journey. It's one of those things that can become a major stumbling block. And if you get the right information and advice, it can make things a bit smoother. So I hope we give some clarity and make the journey a bit smoother for someone else out there. As we normally do on Getting Out, we have a voice note from someone who's got an issue they're going through. And today's voice note comes from Stephen, who found it difficult to get in touch with his GP when he got out. So let's hear from Stephen.
Hi, my name's Stephen. I've recently been released from prison after serving a lengthy prison sentence. And my issue is related to physical health. I wanted to speak to a GP because I've enrolled in a new gym, but where I've served such a long time, the GP that I used to attend no longer exists. So where would you go next? And how would you go about getting that reference from the new GP and accessing your previous records?
Thank you, Stephen, for sending that in. It can definitely be difficult to know what to do in that situation, especially if your GP has moved or if you've moved areas. So our guest in the studio today is Kate Morrissey from the NHS. So hi, Kate.
Hi, Jules.
How are you?
I'm great, thank you.
Good.
Thanks for being here today.
Yeah, thank you. Can you tell us a little bit about yourself and what you do at the NHS?
Yep, so I work for NHS England and I'm the National Implementation Lead, so responsible for setting up a new service called Reconnect, which is our care after custody service.
Where did that come about from?
So I think for a long time we've known that the transition from prison to the community can be really difficult. People who are in prison, people with lived experience have told us that, you know, they're really disconnected from their health prior to going into prison. And sometimes the first time they've connected again is when they're in prison. So we knew that we needed to do more than just send people out and tell them to go and see their GP. So the Reconnect service, which we're currently rolling out across the whole of England, is there to meet with people prior to their release to find out their health needs and then to kind of meet them at the gate if they need to and support them to engage in that healthcare appointment, be that substance misuse, primary care, GP services, mental health or any other health need like dentistry. So sometimes that support can be kind of literally meeting someone at the gate and helping them take them to the appointment, or it could be helping them to arrange those appointments, knowing where to go, how to access health in today's world, because I think we all know, particularly with COVID-19, accessing healthcare has changed to how it might have been when someone went into prison before.
Yeah, definitely.
Yeah. Definitely a lot of changes.
Yeah, so like for Stephen, who now his GP's just moved, they're not there, what would someone in his position do?
So first of all, it's fantastic that he wants to meet with his GP, and the NHS is there for everyone. It's there to keep people safe and well. So what he would, if his GP has closed down or he's moved area, then what he needs to do is find a GP to register with. So that you can do that through the NHS England website, or you could go to a GP surgery that you know that's nearby. So you don't need ID to register with a GP. You don't need an address. Even if you're homeless, you can still register with a GP, but you might need to use a friend's address or to give, you can even give the surgery address as your home address. But you'd also need to make sure that you were contactable, because if a letter is sent to the GP surgery to tell you you've got an X-ray or an appointment, then they need to be able to tell you that letter's arrived. It doesn't matter what immigration status you are, you can still access a GP, and that care is there for you. In Stephen's situation, I think what I'd like to reassure him is that his previous records, it doesn't matter if his GP's shut, his previous records are there, and we also have his records in the prison. Now, how he goes about getting access to those records really depends on how he registered with the GP in the prison. So it sounds complicated, but basically you can either choose to deregister from your old GP and register with the prison GP, or you can choose to just temporarily register with the GP in the prison. So if you've chosen to re-register with the GP in the prison, when you go and register at a new GP, there will be an automatic transfer of all of your medical records to your new GP. It's as simple as that.
That's good.
You just go in, register. You don't need your NHS number. You don't need ID, and they will just transfer that information. However, if you did choose not to register with the prison GP, it's a little bit more complicated. So you can either register with a new GP and then ask them to have a clinical discussion with the prison healthcare. But obviously that does mean that you need to divulge to the GP that you've been in prison. Or he can contact the health service within the prison and do a subject access request. Okay. And that will provide him with any information that they have on the system about him, which he can then take to his GP and be registered.
So with that request for the information, that gets sent to you?
Yes. So if you do a subject access request, all your GP records from the prison will come to you, and then you can take them in. But as I say, they can also, if you don't want to be the middleman in that GP conversation, you can just tell the GP and they will request that information for you. Okay.
So that's two ways of going about that, getting your previous information.
Yes. And the GP, as I say, the GP information that you had before you went to prison will be on the system and will also transfer. So we can, they can say what vaccinations you've had. If you're unsure about that, they can tell you any diagnoses that you have, and they can basically see back to when you were a child.
So then there's two ways, or there's multiple ways that you can get the access to the information. But what I wanted to clarify is, what about if you serve time in multiple prisons then? Do you have to contact all of them, or what is the process then?
So if, as I say, if you've chosen to register with the GP in the prison, that information will just naturally follow you through your journey and then back out into the community. But if you didn't choose to register and you're having to go down the subject access request route, because that information will have flowed from the previous prison to the prison that you've recently left, it would just be the access to that one service.
Okay. So basically the prison you got released from, that's where you should contact, or who you should contact. Okay, cool.
Okay, perfect.
Yeah.
Thank you. So you also did touch on so how does somebody register with a GP? But can you take us through the steps of actually how you register with a GP? Okay.
So before you leave prison, then there's the opportunity to be pre-registered with a GP, which means that the healthcare service in the prison will register you online with a GP. If for whatever reason that hasn't happened, then your first port of call is to find a GP surgery that's convenient to you. Now, it doesn't have to be where you're living, but it helps if it is. So what I'd suggest is you find a GP surgery. Either you know one, ask your friends and family, or you can go online to the NHS website and search for register with a GP, and there's a GP surgery finder on there. So you can do that. Once you've found that out, you need to attend the GP surgery, or sometimes you can email the GP surgery if that's easier, to register with them. Now, they might ask you for ID, but I want to assure people you don't have to have ID to register with a GP. It just makes the system easier. The reason for that is sometimes my real name's Katie, but I always use Kate. So if I go into the GP and say Kate, they won't have a record of a Kate Morrissey. Okay. It would be Katie Morrissey. So that's why they're asking for your ID. You don't have to have an address. So you can register with a friend's address. As I said earlier, you can register with the probation office address if your probation officer agrees, or you can register with the GP surgery address. It's really down to you. What you do need to remember is that GPs don't have to register everyone that attends there. So there are a few reasons why they might deny you registration. One, they're full. So their lists are full. Remember, that's not about you. That's just about the fact that the GP surgery is not accepting patients at this time.
They've got capacity, right?
They've got capacity issues. The other one is if you've already been kicked off their list. So for whatever reason, you've missed loads of appointments, or sometimes people can, be quite abusive to staff and they've been kicked off of the list, then they won't have to accept you. Also, if you're registering with a GP that's not near your home address, if you're going to need extra care, so they might need to do home visits or something, then they won't accept you because actually they can't provide that care. But apart from that, you should be accepted. And if you do have any problems, on the NHS website, there's a contact centre number where we can support you if you can't find a GP in your area that's accepting you as well. So, you know, if you turn down, don't think it's about you. It may be about the situation. And there's also support out there to help you do that. Now, you will have to fill in some forms to register with a GP. But there's also support out there to do that with you. So the Citizen Advice Service can help you, and also the NHS Health Watch Service. So you can contact the Health Watch Service, and I'm sure you're going to give the details of that, and they will help you to fill in the forms and do that. So don't be scared to ask for help, and make sure that you know your rights.
Perfect. Thank you very much.
Yeah, that was like complete.
Yeah,
advice.
that was really great.
Yeah,
and worth going through that process, seeing that you don't need ID, don't need an address, essentially, because you can get the help you need. That it will cover.
I think that's
all
valuable
grounds,
to know, because I think it's quite common that people get released with no address or no fixed abode. So that's really handy to know.
Thank you for that.
Yeah. Imagine not having an address and then you think, I can't get a GP, but when you actually can. So thanks for that. I wanted to go back and touch on the NHS Reconnect service, just to get a bit more detail about what you do, if that's okay.
Absolutely. So the Reconnect service, as I said, it's a new service. So we're just rolling that out nationally at the moment. About 49% of prisons are currently covered by a Reconnect service.
That's a lot.
It's getting there. And in the next 18 months, so by March 24, the whole of the coverage of England, whether there's a prison there or if there's not, will have a Reconnect service.
Excellent.
So Reconnect is very much, it's not a clinical service. We're not delivering treatment to people. It's a support. It's an encouragement, an enablement and an advocacy service. So as I said earlier, people, the Reconnect, you can refer yourself to Reconnect. Your prison officer, the healthcare in the prison, your family, your friends in the community can refer you into Reconnect up to 12 weeks pre-release. The Reconnect worker will come meet with you, find out what your health needs are, and then they will work so if you say you need to go to substance misuse services and the dentist and you need to register with a GP, they'll help you to work out how you're going to do that. So where's your nearest GP surgery? What are you going to say when you get there? They might even meet you at the gate and attend those appointments with you.
Wow.
Or it might be around showing you how to use the NHS app when you get out, because so much is done online now. So they'll then they'll work that plan with you. As I say, might meet you at the gate and then work with you for up to 6 months after you've been released to help you to get to those appointments. So, you know, it's quite daunting. You've got to go to, say, a hospital for an x-ray. You've not been out on your own for a while. You don't know where the department is. You think everyone's looking at you because they all know where they're going. The Reconnect worker can support you, go along with you, help you get there and make sure that you're able to speak up for yourself as well. So that's kind of what we do. And we'd do that if you needed substance misuse, dental and GP, we'd support you to all 3 of those appointments. And it's very peer-led as well. So all of our services have peer supporters as well as engagement workers. So you can talk to someone that knows what it's like, that's been there and that kind of you can relate to. And so we're keen that everyone hears about the Reconnect service and engages with it. Now, when we started setting up the services, it was very much about doing that work pre-release. But what we realised and what people with lived experience were telling us was that they were getting out and they had everything planned. They were going to live with family or friends. And then that quite quickly broke down, which meant that they had to move areas or move houses. And so what we also have is that you can be re-referred back into the Reconnect service for up to 4 weeks after you've left prison, just so that we can help you to pick up if everything's gone wrong and provide that support. And it's not just about getting to your GP and your hospital appointments. This is absolutely about, like, how can you improve your well-being? Are there any other clubs, groups, kind of anything that can support you in your well-being and therefore improve your health. So they'll know where the local gardening clubs are, the gyms that have got cheap membership. You know, it's really about what you need and supporting you to get that.
That's excellent.
That's really good, yeah.
So it's like wraparound support, peer-led, people with lived experience. So you've got that relatability, people understand what you're going through. And it's not just for like your GP, it's dentist, it's if you have substance misuse and, you know, other things like other health options. So
it's
that's
covering all bases, isn't it? Which is great. It's what people need.
Yeah, I think we really listened to people who'd left prison or who were coming up to leaving prison. And they said to us, it feels like a cliff edge. You know, I'm in prison, like I know where to go to get my meds. I know where the healthcare is. I don't have to go and register. And then I get out and it's like, this hospital's in that town and this GP surgery and how do I access it?
You know, health is a worry in itself anyway, you know, like it's so important to everybody. But then having that additional everything else, it puts people off doing it. And I think that's, you know, something we need to help not happen.
And actually we know that health is like fundamental to everything else. You know, if you're not healthy, you're not going to be able to go and advocate for yourself and get a job or go into education. It's like one of those fundamental things. So actually it's the starting point of everything else along with accommodation.
Definitely.
So where can you go to get help? I think you've touched on like things earlier on, but like initially, if somebody's just doesn't even know where to start or doesn't know where to go, where can they get help?
Okay, so the NHS have their website, so you could go on the website to ask and look for the services that you need. There's lots of really helpful search functions. If you have a medical kind of, not emergency, but something you need urgently treated, you can call NHS 111 and they can arrange for you to see an out-of-hours GP. They can give you some advice on how you can self-manage any conditions.
Which have really helped me, by the way. I just want to put out there.
Good.
Past.
That's good to know.
Like they just settle your brain, like settle your head if you are worried about something like there and then.
Absolutely. And they can direct you to the most appropriate course of action, whether that's going to an emergency service, an out-of-hours GP or an out-of-hours dentist. So you can go there. Health Watch can also support you and help you to gain access if there's not a Reconnect service. You can ask your probation officer. So probation have health and justice coordinators that can support you to engage within the local healthcare. So they've got links and contacts. And also, obviously, there's lots of charities and that can support that. And the NHS in England has done a lot of work with Groundswell around accessing GPs. So you can also look on their website for some additional support. Okay,
amazing. Thank you. It sounds like all of these are on quite a local level. Is that right?
Yeah, I think that's fair to say. So whilst Reconnect's rolling out nationally, it's not everywhere yet. So you can find out on our NHS England website where the Reconnect services are at the moment. Additionally, a lot of charities are built up on a local footprint as are health services. So it's always worth looking at places like your local authority's website because they do a lot of support around mental health and well-being, as well as the local charities in your area, but the council websites will absolutely be able to help direct you to them. And also you can ask in your services. So just because you're going to a substance misuse service doesn't mean that they won't know who to direct you to for support with mental health, or they won't know how you can access the dentist. So I think it's just about making sure you use every opportunity to ask people that could possibly help. And the great thing about health is kind of everyone has contact with those services. So it's not like probation where you might only have contact if you've been in trouble with the law. Everyone has trouble with, has health needs and has to have them met. So actually asking people anywhere will really kind of open the door. And that's why we often say go to a GP that you're recommended or speak to people about what charities have helped them, because it's really different locally. It's difficult for us to say on a national level, but the people surrounding you will know.
Okay, thank you for that. It is very true. It's something that most people, if not, everybody will be able to know about and share some information about. So thank you.
Thank you very much, definitely. So before we sign off, Kate, we often do a recap. I want to invite you to just recap the main points that you've covered today, please.
Absolutely. So 1, the NHS is open. It's there to keep you safe and it's there to keep you well when we want to do that. 2, everyone can access a GP. It doesn't matter your age, your homelessness state, where you're living, everyone's entitled to access the GP and you don't need ID to do that, although it helps. 3, the Reconnect services are there to support you in most areas, and they will be coming out soon. And make sure that you're asking about that. If you're in prison now, be asking your healthcare about a referral to Reconnect. And if you're already out, look out for your Reconnect service.
Oh, thank you so much, Kate.
Perfect.
Appreciate that.
Thank you very much.
Are there any other organisations, though, that you can point us in the direction of, or anyone that needs any help with their health?
So, as I say, local authorities do a lot around wellbeing and support. There are national charities such as Mind that then have local groups set up, and places like the National Drugs Helpline. So Ask Frank, etc. They can support you around particular needs. But the NHS website and NHS 111, are your starting point. And register with a GP, because the GP is the entrance into health services. That's how you get there. That they are a front of all knowledge. And it's not just about seeing a doctor. GP surgeries have kind of physios attached to them. They have mental health specialists, paramedics, so registering at a GP is really, really good place to start.
Thank you so much, Kate. Thank you.
Massive thank you. All of the organisations mentioned in today's podcast, we will put in the show notes. So have a look out for them there. And also, if you've learned something about a service that you didn't know about before, please get in touch. We want to hear about it. We want to know what you've learned. We want to know what you've heard. And you can do that by contacting us on our socials, Instagram or Twitter. Our DM is @AfterPrisonPod. Or you can email us at podcast@prison.radio. Or if writing is better for you, then you can send a letter to Life After Prison, National Prison Radio, HMP Brixton, London, SW2 5XF.
Yeah. If you've enjoyed the episode, please like, share and subscribe. It really helps it get to the people that really need to hear it the most. Massive thanks to Kate. Thank you for coming.
Thank you so much.
Thanks for having me.
Big thanks to Stephen for your voice note and sharing with us openly. And we'll see you next time. Thank you for watching.
Thanks.